Hey everybody, welcome to the second video in this three-part video series. In this video we're going to be focusing on the femoral acetabular ligaments of the hip. In particular, for this treatment we're going to be looking at a treatment technique for the ischiofemoral ligament. Now the ischiofemoral ligament is a ligament that is engaged when the hip when the femur is drawn into 40 degrees of internal rotation. Now, we need to assess to see if there's any dysfunction in this tissue. So we sit on the table, we have our patient's knee over top of ours, and we gently internally rotate their femur looking for any tissue resistance before the 40 degrees of internal rotation. If we come next to some resistance into that tissue, then it needs to be treated. The way that we treat and isolate this ligament in the femoral acetabular capsule is we take up the slack in the tissue, bringing their knee towards the ceiling. We draw the femur away from the pelvis, and we internally rotate the femur to the tissue tension in that ligament, matching the reciprocal tension in that tissue. We hold this position until there is a softening of the tissue that is felt. When you feel a softening of the tissue, you will actually be drawn more into internal rotation of the femur. Once that happens, you can release your pressure, go back to your starting point, reassess, and you should feel less resistance going towards that 40 degrees of internal rotation of the femur. And that ends the treatment technique for the ischiofemoral ligament. Now we're going to look at the assessment and treatment for the pubofemoral ligament. With our patient lying in the supine position, we take their pelvis into a 90-degree position. We slide our hand underneath the posterior aspect of the head of the femur, and we slowly abduct their hip, looking to see if the head of the femur gets pushed into the palm of my hand. If it does, then there is a forced coupling dysfunction of that femoral acetabular joint, and the pubofemoral ligament needs to be treated. In treating the pubofemoral ligament, we need to draw the head of the femur anteriorly, of which we will use a Kong in order to place it underneath the posterior aspect of the head of the femur. We then take our knee, place it on the table, and gently and slowly abduct to 50 degrees their hip. In this position, the Kong is now driving the head of the femur anteriorly, and we're causing a lengthening and a stretching to that pubofemoral ligament. We take the hip into abduction, matching the reciprocal tension of the tissue, and if we want, we can engage the patient in the process by having them, with 10% of their strength, gently adducting or adducting, bringing their leg, their knee, in towards the midline of the body. So bring it in. Hold that for 10 seconds. After 10 seconds, relax. And as they relax, the tissue will lengthen, and we can bring the leg further into abduction. Once the tissue has released, we slowly bring their leg back to a neutral position, remove the Kong, and reassess, placing your hand underneath the posterior aspect of the femur, bringing their pelvis into a 90-degree angle, and abducting their hip. And now the head of the femur no longer pushes into the palm of my hand. In this video, we're going to look at a treatment technique for the iliofemoral ligament. The iliofemoral ligament is engaged when you bring the hip into 20 degrees of extension. If you encounter resistance before the 20 degrees of extension, then this ligament needs to be treated. To treat this ligament, have your patient lying in the prone position. Gently place your knee onto the table and place their knee on top of yours. With the leg, but the femur in neutral position, find the posterior aspect of the head of the femur and gently load it anteriorly towards the table. This engages your iliofemoral ligament. Match the reciprocal tension of the tissue. Wait for that tissue tension to release. As it releases, the femur is drawn in a more anteriorly direction towards the table. Once this ligament has released, this treatment position can be altered in order to engage the ischiofemoral and the pubofemoral ligaments. In order to engage the pubofemoral ligament from this position, we abduct the leg a little bit more and we externally rotate the femur. From this position again, we load anteriorly down into the table, matching the reciprocal tension of the tissue, waiting for the release of the tissue. Once the tissue releases, if we'd like to engage the ischiofemoral ligament, then we internally rotate the femur. Again, engage that ligament by loading anteriorly through the posterior aspect of the femur down towards the table, matching the reciprocal tension in that tissue. Once the reciprocal tension releases, we will have an easier direction of ease of the femur into internal rotation. After treating all three ligaments, we can slowly bring the leg back down into the beginning position, and that concludes the second video for the treatment techniques for the hip, which included the iliofemoral, ischiofemoral, and pubofemoral ligaments.